Our health is more than a personal choice. Factors like where we live and work play major roles in determining our well-being. Today, we clearly see the consequences of inequities in our society with the COVID-19 pandemic. For example, compared to white people, people of color in the U.S. are more likely to get sick and die from COVID-19. This is due to systemic racism and discrimination that has resulted in conditions that do not allow for working from home, sick leave, or social distancing, coupled with limited access to healthcare. As a society, we need to pursue evidence-based policies and interventions to strive towards a healthier, more just, and equitable society. These 3 research principles might help. Principle 1. Support research free from conflicts of interest. It is essential to support rigorous research that is free from conflicts of interest. For instance, tobacco-related research should not receive support from the tobacco industry, including manufacturers of e-cigarettes and heated tobacco products. The tobacco industry continues to aggressively advertise and promote their deadly products, and actively lobbies against effective policies and interventions, including those that reduce smoking among youth. Fortunately, the collective work of independent researchers and advocates has debunked contradictory claims and brought to light the tobacco industry's harmful practices. But we must remain vigilant. With the introduction of e-cigarettes and heated tobacco products to the market, the industry is using its old playbook to keep benefiting financially at the expense of our society's health. For example, Juul sponsored youth smoking prevention programs while it heavily advertised nicotine products with flavors to entice youth to use its product. Principle 2. Account for intersecting identities. The tobacco industry will do what it takes to maintain and grow its customer base, but the influences on our decisions to use tobacco products and other decisions about our health are complex. Our identity is defined by multiple factors such as sex, education, sexual orientation, gender identity, race, and nationality, which intersect in many ways and impact our health. Research should consider these important determinants to address health inequities. Principle 3. Bring research closer to the community. The culture within research enterprise must be examined. Like other institutions, research has been predominantly restricted to specific groups of our society, mostly high-income people who could afford many years of formal education. Moving forward, research teams should involve individuals from different backgrounds who bring lived experience in relation to health inequities. And the communities being studied should be actively engaged in the research. Organizations should prioritize funding research teams that are committed to work closely and collaboratively with communities to reduce inequities. Research can support the development of long-term solutions, and we must ensure that it mirrors and supports the world that we wish to live in. A world free of systemic inequity, where we all have the best chance to live our best lives, no matter our background, neighborhood, nationality, income, race, sexual orientation, or gender identity. To learn more, visit globaltobaccocontrol.org.